Hello viewers, welcome back to our series of connecting dots of IVF. I am Dr. Chaitanya Ganapule, fertility specialist and director of Yash IVF centers. Today I am going to address a very important and most frequently asked question: do I need IVF? Friends, this question comes in mind of most of the patients because either they are afraid of the treatment, either they are worried of the side effects of the treatment, or because of the financial burden the treatment is going to have on them. Let me assure you, friends, that only 10 to 15% of couples who seek treatment for fertility need IVF. Rest 85 to 90% of them will conceive through treatments other than IVF and they did not go ahead with IVF. So it's a very reassuring thing when a couple comes to me with a thought in their mind that I have to go for an IVF because I am suffering from or having subfertility. No, that's not the case. Then the next natural question comes, then who needs IVF? Well, to understand or to answer this question, let's take some situations or let's take some examples. A couple comes to our clinic and the male partner has got a sperm count of about 6 million. Such cases wherein the sperm count is less than 15 million or those who have got less motility or very high abnormal sperms may need to go for IVF. But even in such cases, we can definitely try initially to give some medications and improve the count and motility or morphology in spite of giving medical treatment. If the count, morphology or motility fails to improve, then such couples would definitely be benefited by doing IVF. Suppose a woman has got blocked tubes, then in such cases definitely they would like to go for IVF or they would need an IVF. Now, why is it so? Because if you see how conception occurs, the conception always takes place in the fallopian tubes. That's the place where egg and sperm come together and develop into an embryo. Then this embryo travels back into the uterus and gets implanted into the uterus where the further development and growth of the baby for 9 months takes place. But the initiation of this process is in the fallopian tubes. And naturally, if this tube itself is blocked, the egg and sperm won't come together to form an embryo and thus failing to conceive or achieve pregnancy. Sometimes, through surgical interventions, we can definitely try to repair that damage which has occurred to this tube. If it's possible for us to repair that damage, definitely we can try again for natural conception. But if the tube is damaged beyond repair or for some reason if the tubes are removed, then in such couples again IVF is a boon through which they can achieve their dream of parenthood. An elderly couple, if has to go for fertility treatment, may need an IVF. As age advances, the number of eggs which are present in the body keep decreasing, and therefore the time which this couple has in their hand to conceive is less. And that is why to hasten the process of achieving conception or pregnancy, we may suggest such couple to go for IVF because the success rate of IVF is the highest amongst all the different treatment modalities that are available for fertility. IVF at our center has got a success rate of about 60 to 70% as compared to a standard universally accepted success rate of IVF which is about 30 to 40%. So it's quite high as compared to the universally accepted norm of 30 to 40%. But such couples again would definitely be benefited by going through IVF. Now, in some cases where the age is so much advanced that the number of eggs are very low or almost nil, in that cases we have to suggest such couples to go through IVF but with the help of donor eggs. And in such cases, with the help of donor eggs and the sperm from the male partner, the embryo is prepared and transferred back into her womb. She gets pregnancy and she carries the baby in her womb for 9 months and delivers the child. So again, this is a boon for such elderly couples in whom the ovarian reserve is very less, and it's almost impossible for them to conceive through their own gametes. Lastly, there are many women nowadays who are working professionals and they have to concentrate on their careers at this point of time, and therefore they want to postpone getting pregnant for a few more years. But their age is going to increase. It's not going to stop because they have to or they want to postpone their pregnancy. In such cases, such women can resort to oocyte freezing through IVF, and then these frozen oocytes can be used for making the embryos and achieving conception and pregnancy at a later date. Therefore, IVF is also a boon for all such working professionals who want to postpone their pregnancy for this point of time and want to have their own kid in future at some point. So to summarize, as I said in the beginning of my talk, that only 10 to 15% of women will actually need IVF. Rest all 85 to 90% of them will conceive through treatments other than IVF. IVF is a boon for those who have got, say, blocked fallopian tubes or damaged fallopian tubes beyond repair, or in whom the tubes have been removed for some reason or the other, those in whom the sperm count is less, the motility of the sperms is less, or the morphology of the sperm is abnormal. It can also be a boon for those elderly couples in whom the ovarian reserve is compromised and they have less time in their hand to conceive, or in those elderly couples who have got so much of low ovarian reserve that we have to resort to donor eggs, but through donor eggs we can fulfill their dream of parenthood. And for all those working professional women who want to postpone their pregnancy for a few years, can go for oocyte freezing through IVF and can have their own baby in future whenever they want. Wishing all my viewers happy and hope-filled parenthood ahead. Thank you.